Today's Ask the Doctor segment is all about concussions, a big thing in the news right now. Dr. Robert Agee, a board-certified family medicine physician with a special interest in sports medicine, here to take your questions. Give us a call right now, 741-9272. Doc, of course, everybody, when we think about concussions these days, we're thinking about football or kids involved in sports.
Yes.
What does a parent need to know?
You need to know this is a temporary injury to the brain. Most people recover usually within 10 days without any problems long term. What we're trying to do is prevent this from occurring in the first place, or prevent it from reoccurring over and over again. And so getting the word out that, about the symptoms, recognizing it and getting them out of the game till their head recovers so they don't have multiple concussions and multiple problems.
Now, one of the hard things I would think for a parent, especially with a young man who's playing football, they may not tell you. So how do you pull that out of them that, yeah, they got really hit hard?
Absolutely. We right now we're putting more eyes on the field, so our trainers, even our coaches, and having physicians there that can recognize some of the signs and symptoms, recognizing the players not acting the same, and having trouble on the field so that we can pull them out early, because you're right, they don't know, they're not telling anybody, and that's what happens. They get hit in the head, they have symptoms, but they just, they're taught to play through the pain, and then they get multiple hits, and then they end up with trouble down the line, and so that's what we're trying to prevent.
We have our first caller, Carol, calling in. Carol, what's your question for the doctor?
I'm not a football player, but I fell last Monday night and hit my head, and it swelled up real bad, real quick, and we had to, my blood pressure shot up. We had to call the paramedics, and I had to go to the hospital and have a CT scan to be sure that there wasn't any bleeding in the brain. But it's been a week now, and I've still got a knot on my forehead about the size, bigger than a pecan, and I'm dizzy, and the side of my face is swollen. And I wonder, is that a concussion, or is it just the aftermath of what's happened?
That's a good question. I absolutely believe you have a concussion. The interesting thing, you cannot see a concussion on a CT scan, an X-ray, or anything like that. So a lot of times it's on symptoms that you're experiencing. So headache, dizziness, blurred vision, ringing in your ears, bright lights bothering your head. So these are all signs and symptoms. So we go through protocol to see if you have those signs and symptoms, and there's some tests we do called the Standard Concussion Assessment Tool number 3. There was 2 other versions, and now we're up to the 3rd. It really kind of goes on about what to do and how we diagnose a concussion. And so treatment for her would be definitely get in, see somebody that does a concussion evaluation on her, and see if we can do further treatment for her. So yes, I think she does have a concussion now.
Very quickly, one more caller. Christy, what's your question? Christy?
Yeah.
Go ahead with your question.
Yes, I want to ask, my daughter's 24 years old now, and me and my husband was on the way to the hospital when we got in a car wreck, and we had a car wreck, and they said I had a concussion, and I have lost everything since 24 years ago. Could I still have that concussion? Because, like you said a while ago, that one lady, that she's having blurry visions, all that kind of stuff.
Very quickly, if we can answer her questions.
Yeah, you definitely have concussion. These symptoms can last months to years, and there's a lot of vestibular rehab and different things we can do to kind of make those symptoms go away and actually have you function a lot better. So definitely, sounds like you have a concussion, a continued concussion, chronic concussion that needs treatment.
Okay,
so,
get it checked out.
Absolutely.
All right. Dr. Agee, thank you.